I'm Shannon Van Hyfte. I'm a clinical associate professor and the director of clinical education in audiology at Purdue University. So the recently released FDA rule says that we've now created a new category of hearing aids called the over-the-counter or OTC hearing aids. Those are available for persons aged 18 years and older who have a perceived mild to moderate hearing loss, and they can now purchase those directly from a store or a online retail without a medical evaluation or a hearing test or a prescription. So as a whole, the public is going to benefit from this option to have over-the-counter hearing aids. It's going to put hearing loss in the public eye. We're talking about it more, so that's a huge benefit. It also recognizes the research that is out there that links hearing loss with social isolation, depression, cognitive decline, and dementia. Specifically, persons 18 or older with a mild to moderate hearing loss are going to have the option of purchasing these at a lower cost and being able to enter that market a little bit earlier. We know that people who identify hearing loss or a perception of hearing loss take about 7 years before they take action. And so hopefully having these OTC hearing aids available will shorten that gap of time and make this more readily accessible. So OTC hearing aids do not have a specific cost as set by the manufacturers yet, but they will. Our belief is that they're going to be about $1,000 for a pair of those hearing aids. The quality is going to be a one-size-fits-most. So it won't be perfect for everyone, but it will have the option for a volume control, for some basic amplification. The one concern we have is that we do not see a regulation yet on refunds or returns, and there is no maximum gain regulation, and so audiologists have a little concern about potential for damage to hearing, but there will be some basic regulations and quality controls in place. So the OTC hearing aids will be available 60 days past the release date of this rule, which was August 17th, 2022. Folks can go online or to a store directly. Again, if it's a perceived mild to moderate hearing loss, we would always encourage visiting your audiologist first, who may recommend the OTC option over a prescription method, but can rule out any medical contraindications.